socks off, but there's a problem because on any given night in Scotland, 2,000 Scots are stuck in our hospitals well enough to go home, but too frail to do so without a care package to receive them into their own home or a care bed to receive them into the community. That causes an interruption in flow that leads to people waiting 33 hours in a corridor. That's not, that patient bed is no longer a place of treatment. It's a place.
Problems.
No, Colin, that is the selection. Malcolm doesn't understand what he's talking about. He's saying, I've talked to doctors and they've showed me efficiencies that can be saved. Doctors will tell you, free up the social care, make social care a profession of choice, invest in social care, get those 2,000 Scots out of hospital who don't need to be there, who are holding up beds, who are seeing ambulances stack outside A&E, leaving pensioners waiting in the snow for 8 hours. That's all because of social care and the problem.
Hang on, Julie Mackay hasn't spoken on this yet.
For a long time, we've been talking about NHS reform and it hasn't actually happened. We've said we need to have that conversation with the public and with the medical staff as to what we need to do. We need more medical staff for a start. We can't deliver more appointments by working the staff we have harder. They are already at breaking point in many places. They need that support. But we also need...
How do you get more medical staff? I mean, the government has been trying for a long time. How do you get more? You can't just magic them.
No, we can't. Some of the things that we need to do is making routes and alternative routes into some of these professions easier for people to retrain from other places. We need to make it worth their while to be able to do this. There are a great many staff at the moment who are just so burnt out that they're off. That compounds the problems on the staff that are already there. We need to make sure that training places are attractive, and actually often us talking this down and saying how bad it is and that massive crisis will impact on those young people who are thinking about taking that as a career. We need to make sure that the reality is out there and that we challenge the government's record on that, but a constant doom loop is not going to get anybody back into these professions.
Right, in the sense that I think doctors in our GP surgeries actually need other ancillary professions like physio, like mental health professionals to work on alongside them.
Visa scheme to bring more people into the country.
I would look at anything that brings talent into our country that answers that need, but also we need to end the bureaucracy in the NHS. Right now, every doctor needs to have a wet signature on every single repeat prescription that goes through their surgery. That's an outdated concept. In the era of AI, we absolutely need to embrace new technology, but also listen to our GPs who are on their knees.
Craig's busting again.
But if we accept that delayed discharge is one of the fundamental problems in the NHS, that's why it's backing up right throughout the system. But what was the SNP's solution? A national care service that they wasted 4 years constructing that didn't go anywhere, and tens of millions. This is the Scottish elections coming on. This is the Scottish elections. Why did you waste all that time and all that money on a national care service?
Nobody doubts there's a big issue in trying to reform the care service. How did it go for the Tories in the UK? Boris Johnson promised to reform it. There's a reason why it's very difficult to do, and a lot of it's to do with the austerity, which yourselves, the Lib Dems and Labour have followed. That has crushed the resources available to all the areas. I know it's all going now, but you're all in favour of austerity.
Those long waits in the
Hang on, you have your say on that. Let Malcolm come in.
So what I'm hearing is from all established parties, everyone agrees NHS needs reform. We all agree that. We all agree on this. So there's no point just doing the same old thing that we've done for the last 25 years. So let's talk to the medical profession. Let's get a commission together to get this fixed. Let's put a long-term plan together on. And actually for Scotland, who gave healthcare to the world, who created the whole medical profession, we can do this in Scotland.
We've been spending a lot of time talking to medical professionals.